Hi, I'm back. As you can see, I don't have hair anymore. Um, on my previous video, I said I started having a big spot where I lost hair. But by the following day, I decided I don't want to deal with falling hair and clean my house of falling hair, so I just decided to shave it the following day. So, today is I had my chemotherapy last Friday, and today is Sunday. Actually, just past midnight of Saturday. Um, Still feeling okay. Um, just tired, I guess. And I lost a lot of sleep for 2 days. Being on Decadron, because prior to chemotherapy, you have to start Decadron to prevent any reactions from chemo. So the first night before chemo, I lost sleep. So during my chemo session, I just decided to take a nap the entire time. This time it was a little shorter. It only lasted for 4 hours versus 5 hours the first time. The first one was 3 weeks ago. Um, and so the for the second time, it's less because I don't have to take the loading dose anymore. I don't know which medication was that I had to take a loading dose. Um, so for this time, we're actually trying to keep our fingers crossed that I will do much better, that I won't have side effects that were as debilitating as before. Otherwise, um, my oncologist is tempted to change me to a weekly chemotherapy. I mentioned that I'm on, actually, I said Taxol, but I was actually incorrect. I am actually on Taxotere. So I get Taxotere, carboplatin combination for my chemotherapy, and then two biotherapy meds called Perjeta and Herceptin. So we're gonna monitor myself about the abdominal cramping and the burning sensation along my intestinal area, because we're worried about. I have a history of IBS. I was diagnosed like 6, 7 years ago. I did a scope upper and lower part of my GI tract, and I was found to have gastritis, and they didn't really find anything in the lower area, so the doctor just gave me a diagnosis of IBS. And before I got cancer, I noticed that my symptoms started worsening. Like I have the chronic bloating and chronic constipation, and sometimes would alternate with diarrhea. But I didn't really see a specialist for that. And then now I have cancer, so I don't really know what I have. And my doctor said that if you have a history of diverticulitis, um, it's not a good idea to be on Taxotere, um, because I think she had one patient who she put on Taxotere and it ended up with intestinal perforation, um, because of her diverticulitis got aggravated. So I don't really like that. But at the same time, I also don't want to go in every um, week for chemotherapy, because I that means I'm gonna have to get a central line or a portacath, where they put an access here under the skin, and that's where they're gonna do the infusion instead of your regular peripheral veins. And for this chemotherapy, for some reason, um, this vein is still very painful. After getting all these those IV meds, I there were 5 IV meds that I got, so I had to get Benadryl first before getting all those chemotherapy, biotherapy meds. Um, but it's so sore. This vein is so sore up to now. Um, I'm keep forgetting doing a hot compress that should help me calm this, um, inflamed veins. We call this phlebitis. I don't know why that is. The first time, I didn't really feel that. The nurse used a very small gauge of needle from my first chemotherapy. It was just number 24, but for the second one, I don't know if that really makes a difference. Um, the nurse used number 22, so I don't really know. I don't. It looks like I have big veins, so the number 22 should fit in my vein, or it should not stick to the walls of my vein. But I don't know. Anyway, so like if I do weekly chemotherapy, definitely these veins are not gonna be good for that. So I'm hoping and keeping my fingers crossed that my GI issues will be less um, for this from this second chemo session. Now that we've thought about what would be my remedies, um, my doctor was thinking because I actually overdosed on Zofran. From my first video on my chemotherapy, I mentioned I was on a high dose of Zofran, 16 milligrams. I didn't realize I only needed to take 16 milligrams one time in the morning before chemotherapy, and then the next dose would be down to 8 milligrams. But I did 16 milligrams all the way. So this time, I don't really get nauseated. So um, I'm only supposed to take Zofran for 48 hours from the first day of chemotherapy until today. So today I didn't really take all my doses of Zofran. I decided, I'm just gonna take it if I get nauseated. But I haven't really gotten nauseated. I'm starting to feel a little bit of abdominal or epigastric or pain right here, and a little bit of hyperacidity. So I've already started taking my Pepsid, and then in between, because I can only take Pepsid Complete. Pepsid Complete is Tums. It has the ingredients of Tums. It's got calcium, magnesium, and the acid reducer called famotidine. And I can only take that twice a day. So I take it in the morning and I take it in the afternoon. So in between, if when I have hyperacidity issue, um, I take Tums. So I went out to the just the local grocery store in our area. That's the closest. I didn't want to go to the pharmacy, so I didn't find Tums that has the lowest dose because I don't really want to go overdose on calcium. I'm not sure what's the maximum dose, but I usually for osteoporosis, you were to take up to 1500 milligrams per day. I don't know for heartburn if it's okay, and for sure you're not supposed to take it for longer than maybe 5, 10 days. I don't know. I need to read more on it and give you better information. So, the dose that I found from the grocery store was 500 milligrams. So I just decided to take it. My Pepsi, I think, has I don't know how many doses. It has 800. Yeah, it has 800 milligrams of calcium already. So taking two means I get 1600 milligrams, and then if I add 500, then that's um, 12 and 5. That's 1700. That's a lot of calcium. So I guess if you take a lot of calcium, you need to hydrate really good. So drink lots of water. That's gonna be my next step. Um, I think you can take as much as 2500 to 3500 for heartburn, but only for a few days. You can take it for a long time. So I don't know, but usually my from the past experience, my abdominal issue only lasted for about 10 days. So hopefully that'll be safe enough for me to take Pepsid and Tums combined. At the dose that I plan to take them, um, from the last video that I made too, I said that I had, the most one of the most debilitating issues for me was the achiness, the achy joints, and the generalized body pain. The doctor said there's really nothing we can do about that, but definitely Advil is not a good choice for me because of my abdominal issue. So I will just reach for my narcotics. I still take narcotics for my breast pain anyway, so that's still available for me because I'm still doing my breast expansion, but now I do my breast expansion um, usually a day before or on the day of my chemotherapy because that's when I'm the healthiest. My blood count looks much better. Um, so yeah, now I'm doing breast expansion once every 3 weeks instead of once a week. The narcotics still available for me for my breast pain, so I can take Percocet and then Valium for muscle spasm. So that's just what I'm gonna do. Take that for my generalized pain, and the doctors. I asked the doctor whether it was okay to get a massage. So I'm just gonna go get maybe a moderate, um, firmness for massage. I am used to really getting a massage, and I liked um, heavy massage, but we're prone to bruising because chemotherapy brings down your every blood cell that you have, which you know, and part of it is platelet, which is responsible for blood clot. So if you don't have a lot of blood clot, then you can bruise. So yep, I'm just gonna plan on getting a light to moderate massage if I get to go in for massage. So I'm just hoping and praying that for this second session that I had, that everything will be much more tolerable and I won't have to do the weekly session. So that's all, folks, for tonight. I'm gonna give. That's all that I'm gonna talk to you about. But I'm gonna be doing a video next on some of a few shopping tips that I did. Because when you're on chemotherapy, you are um, immunocompromised, meaning your immune system is low, so you can easily get an infection. So we're not supposed to eat any raw food. Um, we can still eat fruits, but we really need to wash it really good. I you know put my fruits in the water for 20 minutes, wash it for a long time. um, Today I bought a lot of pasteurized products, so I'm gonna show them to you on my next video, because those are the foods that I plan to eat when I can't eat, when my GI issues become worse. So okay, I'll talk to you later, and good night.